In 1902, our sisters came to Austin. The Daughters of Charity came with faith, with great faith, to fulfill our mission. They really came for the poor and the vulnerable. And essentially the very first people who invited the sisters to come, they felt like the needs of the people were not being met. There was some philanthropy started to get the hospital for the needs of the people.
Philanthropy really is at the core of who we are at Seton. It's been a tradition, it's been at the history, it's been at the roots of how we take care of our community.
The facilities began with that one facility in 1902 when the doors opened, and has grown to 5 core hospitals in the central area here. So if not for the philanthropy back in that point in time, we wouldn't have the Seton that we have today.
The whole idea is to be a Catholic healthcare system that's available to people throughout Central Texas.
Ascension Seton is a nonprofit healthcare system. The Seton Foundations were established to support the healthcare system throughout Ascension Seton. Each Seton Foundation is anchored by its hospital. We make sure the support and the personal passions of our supporters align with where they want those funds to go, because we recognize that each community is unique. So we make sure that our philanthropy aligns with that unique community.
And if you look across our network, it's about listening to what the community needs and then responding to those needs.
He's jumping! Woo!
That nonprofit piece, that philanthropy piece, helps us get to the next level. It's the ability to help us provide not only the top programs, the top healthcare, but also recruiting some of the top physicians to our community. Philanthropy provides impact, and that's the difference maker in healthcare.
It's more than just good healthcare. I believe you can get good healthcare in a lot of places. I believe what we offer is something distinctively different. It's holistic, spiritually centered care that I believe is second to none in the country. We really have the opportunity to enter into people's lives as a healing ministry at a pivotal time. We use the phrase poor and vulnerable in our mission. We are known across Ascension for our charity care. Dollars that go a long way to help a person who cannot pay for their care.
Over the last decade, Ascension Seton and the Seton Foundations have helped provide over $3.5 billion worth of charity care to those that are underinsured or uninsured in our community.
As in any major city, there are a lot more hidden poor. There are more people who are just, one major medical thing can really throw them completely off track. And all of a sudden, they are the poor and the vulnerable.
The gifts from a philanthropy standpoint enable us to think outside the typical walls of a constrained budget and really to provide innovative care to our community in ways that we wouldn't otherwise be able to do. It's the gift of impact not only with the individuals, but also the families.
I love the word foundation. When you invite people to donate to a foundation, you are contributing to the base of what helps us to do our ministries. Nobody's asking you to be a physician or be a nurse or run all those fancy machines, but you can be a part of our ministry by offering to be a part of our philanthropic efforts.
When we look at Central Texas, it has double-digit growth over the next 5 years. So as the community grows, we'll continue to grow and meet those needs for those with means and those without means. And we're just getting started.
Healthcare is a passion to many of us here in Seton Foundation. It's Ascension Seton. Without our supporters in our community, our mission and what we do day in and day out would not be possible.
We are a missionary community. We go where we're sent, and that's a really important piece in that when we came to Austin, we knew we wouldn't be here forever. Now, I hear people say, well, Seton's not the same since the sisters left. We left here because we knew we could and you'd carry forward. And you're like, no, we can't. And we're like, yes, you can, yes, you can. I feel like the spirit of the Daughters of Charity is clearly still in the bones of this organization and is being carried forward in a beautiful way. I believe being a part of this is a way to influence the direction of how our health ministry goes off into the future.